Our respiratory system, a complex network of organs, is our lifeline. It's a fascinating system, but it can be vulnerable to infections. Lower respiratory tract infections affect millions worldwide. These infections target the lower parts of our respiratory system, including the lungs. Imagine our respiratory system as a tree, with the trachea as the trunk. The branches, our bronchi, lead to smaller twigs, the bronchioles, culminating in delicate leaves, the alveoli. Lower respiratory tract infections impact these lower branches and leaves, disrupting this vital process. The human respiratory system is divided into the upper and lower tracts. Upper respiratory infections cause colds, sinusitis, and laryngitis. Symptoms include runny nose, sore throat, and hoarseness. These are generally mild and resolve with over-the-counter remedies. Lower respiratory infections affect the trachea, bronchi, and lungs. They cause bronchitis and pneumonia, leading to serious symptoms. Medical intervention may be required, including antibiotics. Recognizing the difference is crucial for proper treatment. Lower respiratory tract infections, like unwelcome guests, can be caused by a variety of invaders. Understanding these culprits is the first step in prevention and treatment. Viruses, the masterminds behind the common cold and flu, are the most frequent offenders, accounting for a significant proportion of LRTIs. These microscopic invaders can spread through the air when an infected person coughs or sneezes, or through direct contact with contaminated surfaces. Bacteria, another group of microscopic culprits, can also trigger LRTIs, leading to infections like bacterial pneumonia. These infections can be more serious, requiring prompt treatment with antibiotics. While less common, fungi and parasites can also cause LRTIs, particularly in individuals with weakened immune systems. These infections can be more challenging to treat and may require prolonged courses of antifungal or antiparasitic medications. Certain risk factors can increase the likelihood of developing LRTIs. These include smoking, which damages the lungs and weakens the immune system, and chronic respiratory conditions like asthma and COPD, which make the lungs more susceptible to infections. Lower respiratory tract infections often wave red flags, signaling their presence through a range of telltale symptoms. Recognizing these symptoms is crucial for seeking timely medical attention. Cough, a common symptom, can range from dry and hacking to wet and productive, bringing up phlegm or mucus. This reflex is the body's attempt to clear the airways of irritants and infection. Shortness of breath, a feeling of not getting enough air, is another warning sign. This occurs when the infection affects the lungs' ability to exchange oxygen and carbon dioxide effectively. Chest pain, often described as sharp, stabbing, or burning, can accompany LRTIs, especially if the infection involves the lining of the lungs or the chest wall. Other symptoms may include wheezing, a whistling sound during breathing, fever, a sign of the body fighting off infection, and fatigue, a general feeling of tiredness and weakness. If you experience any of these symptoms, it's important to consult a healthcare professional for proper diagnosis and treatment. Early detection and intervention are crucial for preventing complications and ensuring a speedy recovery. Section 5. Navigating treatment. Combating lower respiratory tract infections. Combating lower respiratory tract infections requires a multi-pronged approach, tailored to the specific cause and severity of the infection. Treatment options range from home remedies to prescription medications, and in severe cases, hospitalization. For viral LRTIs, rest is often the best medicine. Allowing the body to conserve energy and focus on fighting the infection is crucial. Staying hydrated by drinking plenty of fluids helps thin mucus and soothe the throat. Over-the-counter medications such as pain relievers and decongestants can provide symptomatic relief, alleviating fever, body aches, and nasal congestion. However, it's essential to consult a healthcare professional before giving any over-the-counter medications to children. Bacterial LRTIs, on the other hand, require treatment with antibiotics. These medications target and kill the bacteria, preventing further spread and complications. Completing the full course of antibiotics as prescribed is crucial, even if symptoms improve before the medication is finished. In severe cases, hospitalization may be necessary. This allows for closer monitoring, oxygen therapy if breathing becomes difficult, and intravenous fluids and medications if needed. Section 6. Prevention is key, shielding yourself from lower respiratory tract infections. While lower respiratory tract infections can be formidable foes, we are not defenseless. Simple yet effective preventive measures can significantly reduce our risk of contracting these infections. Hand hygiene is our first line of defense. Washing our hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating and after using the restroom, can break the chain of infection. Vaccination is another powerful weapon in our arsenal. Getting vaccinated against influenza or flu and pneumococcal disease can significantly reduce the risk of developing these LRTIs. Avoiding close contact with sick individuals is crucial. If someone you know has a respiratory infection, maintain a safe distance and avoid sharing personal items like utensils, cups, and towels. Wearing a mask in crowded or poorly ventilated spaces can also help reduce the spread of respiratory droplets, especially during flu season or if you are at higher risk of infection. When breathing becomes a battle, understanding pneumonia. Pneumonia, a serious lower respiratory tract infection, occurs when the air sacs in one or both lungs become inflamed and filled with fluid. This inflammation hinders the lung's ability to exchange oxygen and carbon dioxide effectively, leading to breathing difficulties and other complications. Pneumonia can be caused by various microorganisms, including bacteria, viruses, and fungi. Bacterial pneumonia, often more severe, requires prompt treatment with antibiotics. Viral pneumonia, on the other hand, typically resolves on its own with supportive care, such as rest and fluids. Symptoms of pneumonia can range from mild to severe and may include cough, fever, chills, shortness of breath, chest pain, fatigue, and confusion, especially in older adults. Diagnosis usually involves a physical exam, listening to the lungs with a stethoscope, and imaging tests like chest X-rays to visualize the lungs and assess the extent of infection. Treatment for pneumonia depends on the cause, severity, and the individual's overall health. Antibiotics are the mainstay of treatment for bacterial pneumonia, while viral pneumonia is managed with supportive care and antiviral medications in some cases. Decoding bronchitis. A closer look at another common infection. Bronchitis affects the bronchial tubes, causing inflammation, narrowing airways, and persistent cough. It can be acute or chronic, with acute usually caused by viruses. Chronic bronchitis is often linked to smoking or lung irritants. Symptoms include cough, mucus, shortness of breath, chest discomfort, and fatigue. Diagnosis involves a physical exam and medical history review. Chest X-rays may rule out pneumonia. Treatment focuses on symptom relief and supporting healing. Antibiotics are ineffective against viral bronchitis. Chronic bronchitis requires long-term management to control symptoms. This may include medications, inhaled steroids, and pulmonary rehabilitation. The importance of early detection and treatment for lower respiratory tract infections cannot be overstated. Early diagnosis allows for timely intervention, preventing the infection from progressing and causing serious complications. When symptoms arise, seeking prompt medical attention is crucial. A healthcare professional can accurately diagnose the infection, determine its cause, and recommend the most appropriate treatment plan. Delaying treatment can have serious consequences. Untreated lower respiratory tract infections can lead to complications like pneumonia, respiratory failure, sepsis, and even death, especially in individuals with weakened immune systems or underlying health conditions. Early detection and treatment significantly improve outcomes and reduce the risk of complications. By recognizing the symptoms, seeking timely medical attention, and adhering to the prescribed treatment plan, individuals can increase their chances of a full recovery and minimize the impact of lower respiratory tract infections on their health. Conclusion: empowering ourselves against lower respiratory infections. Lower respiratory tract infections, while potentially serious, are not insurmountable obstacles. By understanding these infections, we empower ourselves to take proactive steps to protect our health and the well-being of our loved ones. From practicing meticulous hand hygiene and getting vaccinated to recognizing the symptoms and seeking timely medical attention, we can significantly reduce our risk of contracting these infections and minimize their impact. Remember, knowledge is power. By staying informed and adopting preventive measures, we can breathe easier, knowing that we are equipped to combat these common yet potentially serious infections. If you experience any symptoms of a lower respiratory tract infection, do not hesitate to consult a healthcare professional. Early diagnosis and treatment are crucial for ensuring a swift recovery and preventing complications. By working together and prioritizing respiratory health, we can create a healthier and more resilient world, one breath at a time.